Our nonprofit association has taken about 10 years to develop a patient-physician cooperative so that we could have health care directly from physicians paid for directly by patients. We created it in Houston, Texas initially, and then we expanded it to Portland, Oregon, and now into other cities and states in Texas, in and around Texas. And we want to try to explain what we've added to this program to make it fit the needs of the patients. Many people purchase discounts for vision and dental, and also for towing for their car, and for discounts on durable medical equipment, and for having access to doctor care on the telephone through telemedicine. They purchase that in additional contracts and additional policies, which they buy from many different sources, but they pay an extraordinarily high price for it. Sometimes as much as $50 to $100 a month per person for those kinds of discount programs. So we discovered that we could buy those discounts programs from the providers of discounts and the people that packaged it as an association, that we could buy it at the wholesale price. The result of all this is a program we call PPC, or Patient Physician Cooperatives. That's the sponsoring association, and all of the players in it are either in employer trust or they're individually getting minimum essential coverage by buying directly their health services from the primary care physicians, the labs, the imaging, and the discounts programs that we offer. This program is available to anybody in the United States because it's not restricted geographically in its authority, but it needs to be developed and organized locally because healthcare is a local matter, and getting care that's good has to come from the desire of the patient to pick primary care physician and the physicians that primary care physician would refer to, and to develop a pathway to care that will result in good health and good outcomes for the patient.
Hello, my name is Jenny McCormick. I am a patient advocate for the PPC. The philosophy of PPC, and the reason we have patient advocacy at PPC, is because we understand that health happens in a context. So if the context is supportive, you have less chance of having high-risk episodes of entering the medical system in a way that is hurtful, for example, going into the ER at an acute stage of illness. What we would like to do at PPC is identify ahead of time what the patient's needs are, what their needs are for support in the health realm, the financial realm, and also in the personal realm in terms of personal support you have around you for having the best of health outcomes. All of these factors affect your health outcomes in the long term. So our purpose is to educate you on the systems, on the best choices that you have within those systems, and to support you all the way through that process so that there are no drops there are handoffs between for example, your doctor's office and the specialist's office, that you are very aware of what is expected of the physician and what is expected of the other players in the system to make this process very, very smooth and very supportive, so that your health is in the foreground and your experience of that process of healing is in the foreground. That's our purpose. So if you have a chronic condition, call us so that we can set up care for you, so that you have a care pathway established. If you have an acute problem, call us as soon as you possibly can. Call the member hotline, and then we will follow up with you to establish an acute care pathway. So please don't wait. Get yourself your plan for the best. and expect the best. That's what we'll do here at PPC.
The reason why we have a patient advocacy program is because sometimes encountering the healthcare system is difficult, frightening, and if you don't approach it the right way, you can find yourself in different kinds of trouble. You could find yourself dealing with a doctor you don't know. You could find yourself with huge medical bills. There are a lot of pain points in healthcare right now. And when you're trying to heal and recover, it's better to have somebody on your side who will kind of make sure that all that hard stuff is out of the way and you can focus on your healing. So, patient advocacy is not a new thing. This has existed in healthcare for 15 or 20 years. But in the past, usually it was a family member who was the advocate for the patient. And in really rough situations, people had to be their own advocate. Recently, different kinds of entities and organizations like hospitals and clinics have brought on patient advocates to work internally for them. Also, some employers have patient advocates. Now, what makes us unique is we represent your interests. When you deal with a patient advocate in a hospital, usually they have the interest at the hospital as much as they have your interest in mind. That's kind of what's different about us. We're here to support you. So please reach out to us when you're having an issue, if you are approaching some kind of crisis in your life in the healthcare realm. Get with us right away. Call our member services number or get a hold of a patient advocate. We're here to take care of you. Thank you.
Hola, soy Karina, trabajo para PPC. Somos defensores del paciente. Estamos aquí para ayudarle. Cualquier pregunta y problema que surja con su salud, llámenos. Es importante tener una relación y líneas de comunicación abiertas entre usted y nosotros. Para cualquier emergencia o cualquier pregunta que usted tenga, nos pueda llamar con mucha confianza y le podemos dirigir del modo apropiado. Por favor, no espere hasta que sea muy tarde para llamarnos cuando surja una emergencia o sea cualquier pregunta que usted tenga. No espere hasta el último momento. Estamos aquí para ayudarlo y guiarlo. Gracias.
The brilliant things that PPC did is that it said we want to control those costs through using what's known as 340B pricing. It may not mean anything to you, but in the administration world, it means quite a bit. It means that this is the financial structure by which hospitals are able to negotiate certain classes, therapy classes of drugs and get the very deepest amount. So we have some very rigorous and very tight administrative controls and rules that were set forth by Mike and Don McCormick that meet the guidelines of PPC to try to keep the prices low. And this system is designed to make PPC strategies work. That is what we're designed to do. For the employees, we want it to be that really smart, personalized retail experience. We want it to be easy if you end up doing any of the self-enrollment. My hot thing is transparency. You want the transparency components to it embedded. There's some really very cool consumer tools so the employers can actually communicate. PPC can communicate via text or email to anybody who's in the eligibility base, and it can be a blanket statement. It could be, we have a hurricane and they want to say, if you're experiencing difficulties and need aid, reach out to this telephone number. It can be as simple as that. And it could be global for PPC or it could be employer specific. So its communication ability is awesome. And for you, as agents of the employers, it provides you that flexible system that can be configured to the needs of PPC, and as it grows and expands, gym memberships or whatever it adds on next, streamlining enrollment and enabling greater engagement of the employees. And then it also provides an opportunity to actually measure the value because you can quantify it in terms of how long did it take to enroll. You can make the process simpler. You can get a point of assurance back to the employer.
My name is Michael McDermott. I'm the Marketing Director of the Patient Physician Cooperative. Probably going to ask, what is a cooperative? What it is a healthcare plan with no insurance companies involved. The hardest part about delivering a quality of care is having insurance companies between you and the provider, the physician. At PPC, we have eliminated that problem and became a cooperative to process the claims and develop the relationship with doctors in your community. Because now when you have let go of the insurance companies to provide health care, the cost dramatically drops. So what we try to do at a cooperative is give the best possible health care from your providers in the community that you live.
Hi, my name is Dr. Randa Stenowan. I'm the CEO of Houston Medical Imaging. I'm a diagnostic radiologist, and I'm in charge of the facilities here at Houston Medical Imaging. Because of the fact that I'm both a physician as well as the administrator of Houston Medical Imaging, I wear several hats. Briefly, Houston Medical Imaging is an outpatient diagnostic imaging center. We've been around since 1998. We have 5 locations. We offer high-quality imaging, including MRI, CAT scan, nuclear medicine, PET scans, ultrasound, DEXA, and digital mammography. My particular interest in things that I spend more time on than anything else is oncology. I do a lot of biopsies, probably more thyroid biopsies than most radiologists in town. I'm also adept and interested in prostate imaging, so we take care of a lot of patients, both with prostate cancer and those who are looking to diagnose their cancer, working in concert with the local urological community. We pride ourselves on having high-quality equipment, multi-specialty radiologists, and we try to be basically kind, because not only do we treat our patients, but we treat our families and our friends. We recognize that as a patient, you have many possible choices in the healthcare community. The things that you should realize as you go out into your search is that you have to look at certain issues. They include price, they include quality, accessibility, compassion, expertise. We pride ourselves on the fact that we're owned by physicians. As radiologists, as physicians, we're interested in providing the highest quality care to our patients. As an outpatient facility, we frequently are much less expensive than hospital-based facilities. So when you're looking for a person to take care of you, ask your doctor who they trust. Look for someone who provides high-quality services, multi-specialty imaging, and someone who's going to take care of you in a compassionate and kind way.
My name is Dr. Alice Jim. I'm board certified in internal medicine and geriatric medicine, currently in practice with Texas Medical and Geriatric Center. The focus and theme of my practice is the fact that your care and well-being is our priority. We have able staff that will work together to ensure that your well-being is well taken care of. I'd like to say to you that given the opportunity, we would love to take good care of you. At Texas Medical and Geriatric Center, we do all we can to ensure that every new patient, and every patient as is, leaves satisfied. Patient satisfaction is a top priority with us.
My name is Araceli Alexander. I'm a service linkage worker here at Avenue 360. The primary role for a service linkage worker here at Avenue 360 is to assist patients that are either newly diagnosed or existing diagnosed HIV patients. And our focus is either uninsured or underinsured patients, and we just want to make sure that they don't have any barriers that prevent them from getting medication. And for patients that are interested in seeking our services, if you've never been tested before, if it's your first time, even inquiring about our services, we just want you to know that we're here to help you out. We'll help you out along from the beginning to the end to ensure that you feel comfortable with us and also seek the help that you need.
Our focus is prevention. The number one cause of death in America is heart attack and stroke. 1 million Americans die every year of that disease, and our focus is to prevent that. Well, when a patient chooses a physician, I think they want somebody who listens to them. They want somebody who they can communicate with. So I try my best to listen to my patients, to get their perspective, to understand their concerns, and then I attempt to educate them regarding what I think is important in their overall health care.